Thank you. Good evening, friends. On this wonderful evening of 23rd of August, I welcome you all to the webinar on being organized by the ISSH. The webinar is on the National Hand Surgery Day, which happens to fall on the 23rd of August. And I, Dr. Anand Chandak, welcome you all to this wonderful webinar. The theme for this webinar is Safe Hands, Full Life. Now, National Hand Surgery Day is being celebrated on the 23rd of August every year, because this happens to be the foundation day of the Indian Society for Surgery of the Hand. And on this day, the ISSH and the various team members, the ISSH members and the hand surgeons, they conduct awareness activities for the general population and other medical colleagues, so as to sensitize them for the preventive aspects of hand surgery or the hand problems, the sensitized to understand the importance of the specialized care for these hand injuries, and understand the need for early and effective management to prevent the disability of the hand. Now, hand disabilities are bothering to the patient because hand is a very unique organ. The thumb is in opposition to the fingers, and that gives us the varieties of pinches and grasps to conduct our daily activities. The fingers have three different joints in them, and there is a differential movement of the finger joints which we can do with high precision, thereby giving us very much dexterity. The fingertips are richly innervated with the nerve endings, and all of these give a high versatility to the hand, giving it precision and various gripping activities and prehensile activities. Now, all of these activities are the ones that determine the differentiation between the humans and their predecessors. And so the hand is a unique organ which needs utmost care. Hand fractures are complicated by deformity from no treatment, stiffness from over treatment, and both deformity as well as stiffness from poor treatment. And hence, meticulous management of hand injuries is essential for a good function and thereby preventing the disabilities of the hand. Now, why so? Why hand problems are so tricky and delicate? Because hand itself is a very intricate organ. It's a very complicated organ. If we see the representation of the brain, the hand and the face, these are the two organs which have a major representation on the motor and the sensory cortex. That determines, or that shows, how functionally significant the hand is for the body. Anatomically also, it is composed of 27 bones, apart from the radius and ulna, which also form part of the hand. And there are 19 small muscles in the hand and 24 muscles coming across the wrist, thereby creating a hand a very tricky and a delicate organ with multiple joints, ligaments, tendons, and the bones. And so hand problems are really tricky to diagnose and treat. And hence, hand surgery is a different subspecialty in itself. Now, going back to the history of hand surgery developed as a different subspecialty during the World War II to cater to the war victims. And at that time, there was no separate subspecialty like hand. And so the orthopedic surgeons, the plastic surgeons, the vascular surgeons for the vascular work, the neurosurgeons for the nerve work, all teamed up together and performed these complicated operations. And hence the need for hand surgery as a different subspecialty arose. Basically, hand surgery now is a combination of orthopedic surgery and a plastic surgery. And a specialized training for hand surgery is needed after our completion of orthopedic or plastic surgery residency, so as to become a hand surgeon. Hand surgeons typically deal with each and every problem of the hand, starting from the fractures and dislocations of the fingers and the joints, to ligament injuries, to tendon injuries, to nerve and the vessel injuries, and everything. And hence, in simple words, any and every problem concerning the hand should be treated by a hand surgeon. Hand surgery in India is also not new. Hand surgery started in India in way back in 1951 when Sir Paul Vincent Brand started the hand surgery department at CMC Vellore. The ISSH, the mother body of all the hand surgeons of India, the Indian Society for Surgery of the Hand, was established in 1973 on this very date, the 23rd of August, which is now celebrated as the National Hand Surgery Day. And now it's a growing body with 930 plus members as of now. Very soon, we would be celebrating our 48th annual conference of Indian Society of Surgery for the Hand in association with the Asia Pacific Society and the Asia Pacific Wrist Association. This is to be held at Mumbai from 9 to 13 September. And coming back to the today's webinar. So National Hand Surgery Day 2025, the theme provided by the ISSH is Safe Hands, Full Life. Because once there is a disability in the hand, the functionality of the patient is affected, thereby affecting his full life. And so we are here to create an awareness on sports injuries, excessive use of smart devices, repetitive stress injuries, workplace injuries, and pediatric and domestic hand injuries. Now, I would request my first speaker, Dr. Karn Maheshwari, to give his presentation on the sports injury prevention. I welcome Dr. Karn for that.
Good. Audible and visible.
Yes, visible now. Yeah.
Okay. So, good evening, everyone. I'm Dr. Karn Maheshwari, specialist hand surgeon from Krisha Hospital, Ahmedabad. On this World Hand Surgery Day, today I'll be speaking on important and timely topic, that is prevention of hand injuries in sports. So, increasing participation we are witnessing a rise in hand injuries, some of which can have long-term functional consequences of not managed properly. So let's begin with the overview. Sports-related injuries are becoming common and they range from sprain, strains, fracture, tendon injury to chronic overuse conditions, among which followed by ligament, for which Swanson in 1970 rightly said, hand injury can be complicated by undertreatment, leading stiffness and deformity and stiffness both by poor treatment. So here we want to avoid all of these three: injury, deformity, and stiffness. So the best strategy which is using protective gears specific to the sports, proper training and conditioning, especially strengthening of wrist, finger, and flexor muscle of forearm strengthening, recognizing proper red flag signs early, and having a clear vision on-field management protocols for injury.
Karan, sorry to interrupt. Could you share your screen? Your PPT is not visible.
Sorry.
If you could share your screen. Thank you.
I think
Also, it seems your screen, the signal is breaking. If you could like switch off your video and just show your screen. So.
Is the screen visible now?
It hasn't. Yeah, now it is.
Is the screen visible now?
Yes, it is. You can continue.
Yeah, please continue.
I think the slideshow running has stopped. We'll do one thing. Should we like next speaker should start and I'll take it afterwards? Is that fine?
Anand
Now is it visible? Now that
Yeah.
the screen is
Yes.
changing?
Yes.
Okay. So the protective equipments, we were there at the protective equipments. So protective equipment should be tailored to the specific sports and the position of the player Like cricketer benefit from padded gloves, gymnasts may benefit from tappings and grips, and goalkeepers use specialized gloves with the finger support. And it's not just about wearing proper gear, but wearing right kind in a right way. Now, to make hands stronger, sport-specific rehabilitation should be done, like strengthening exercise, conditioning, and flexibility work should be done, including grip strengthening exercises, which includes intrinsic as well as extrinsic muscle exercise. And even with the best of the preventive protocols, if injury occurs, immediate management can prevent long-term complications, like proper initial assessment, immediate first aid treatment with immobilization, wound care, and pain management. And here, the most important is be alert for red flag signs, which include severe pain, swelling, and loss of movement. We should examine each and every joint for the movement. And any of this is present, then athletes should consult a hand specialist immediately. To avoid hand deformity, diagnosis is the cornerstone for effective treatment, which includes standard AP and oblique X-rays routinely, but those are not enough every time. For finger injuries, take a true lateral or dead lateral view, what we call a dead lateral X-ray, to assess alignment and fracture pattern, and maintain a low threshold for CT scan for complex fracture, and use MRI when soft tissue injury is suspected. Treatment depends on the type and severity of injury, where minor injuries can be treated conservatively with a RICE protocol, rest, ice, scrap bandage, and elevation, and stable fractures can be treated with immobilization with splint or cast. But displaced or unstable fractures may require surgical fixation, for which the part which is most neglected is proper reduction. So general reduction criteria are mentioned here to prevent any deformity. Here, articular displacement and rotational malalignment cannot be accepted. And hand is for free movement. And one of the most disabling consequences after injury is stiffness. So to prevent this and we can prevent this through following return to play criteria, which includes early and control mobilization, which includes active and passive range of motion exercise, edema control using compression or elevation, and a progressive strengthening plan that includes isometric exercise, functional training, and proprioceptive exercise. So before an athlete return to play, ensure that strength and flexibility are fully restored. So just to summarize, prevention, protection, and proper rehabilitation are three pillars. Recognizing injury early and treat them appropriately. Avoid both under treatment and over treatment. And as a hand surgeon, our role is not just to treat, but to educate, guide, and to protect. Thank you for your attention.
Thank you, Karn, for the wonderful presentation. That would be of great help for the sports persons in particular, and now anybody and everybody, because sports are a part and parcel of life now.
Yes, sir.
Now I would request my next speaker, Dr. Karan Chaudhary, to start sharing his screen. His talk is on excess use of the smart devices and RSI prevention. Just like sports, the smart devices are a much bigger part and parcel of our life now. Over to you,
Just
Karan.
yes, thank you. 1 minute, huh? I'll just see if um can you see my
Yeah,
screen?
yes, your screen
Can
is
you
seen.
hear my
Yes,
voice?
perfect. Yes, perfectly fine.
So,
Carry on.
happy hand surgery day to each and everyone here. Um, I'll be talking on the hidden costs. So I had just modified the title of my talk to the hidden costs of smartphones that has risen by leaps and bounds. And I'll be talking about what all things are we facing today in our daily practice as a hand surgeon. So, what do we see as Indian smartphone habits, like, which are typically presenting to, I mean, Indian patients per se? I mean, not just the world figures. So, Prolonged texting and chatting. So we would see people just, I mean, fastly typing with their both the hands and both the thumbs. There is mobile gaming. People are watching videos in bed, voice and video calls with the elbow flex for prolonged hours. So all these things sum up to count as 1.1 lakh crore hours per year by the Economic Times. So this is like 1.1 hours in total, trillion hours that are spent on the phones in 2024 collectively. So why does this matter? More than around 5 hours of phone holding is quite typical. Thumb and wrist pain with rise in hours held, which rises in hours held, and one hand thumb with heavy postures. And systematic and new studies link heavy smartphone users to upper limb musculoskeletal pain. That is, sustained repetitive thumb and wrist loading with deviated wrist and elbow postures give rise to RSIs. So these are some of the research articles that I was searching on uh, of smartphone addictions, text neck, thumbs. And also there is one paper from our physiotherapy college which states that text neck syndromes and SMS thumbs are quite common, especially in the younger generation. So coming to, I'll be speaking on five SRSIs, repetitive stress injuries. First being the decurvent stenosynovitis or the texting thumb. When a person is prolonged swiping or texting through his thumb with ulnar deviated wrist or prolonged gaming, and evidence shows that there has been a Frankenstein's test, which is a deviation of an ulnar deviation of the thumb, and causing positivity with more than 8 hours of phone usage and marathon messaging. Second, RSI is the flexor tendon overload that happens, and which also causes trigger thumb and fingers. And this happens with forceful repetitive tapping and gripping, especially in dominant hand scrollings. And also FPL tendons become thickened, which are also demonstrated on ultrasound, and more activity on prolonged texting. And the tendon thickens depending upon how many messages are being typed and the text has been sent in a day. The third RSI is the carpal tunnel, which is a median nerve that goes into an overload, and that happens because of the flexion and extension of the wrist and radial deviation while holding or typing, that is in the bed. And evidence suggests that the carpal tunnel pressure increases in any sort of wrist deviation, whether it is flexion or extension, radial or ulnar, and it increases the pressure, which progresses further to carpal tunnel syndrome. The fourth repetitive stress that happens in the elbow, which is also called a phone call elbow. Long calls, usually in Indian patients, we see when they are doing long distance callings and during their work or doing domestic activities, when the elbow is held in a 90 to 120 degrees flexion, where the arm is just suspended or the patient is scrolling in that position. With a flexion that is more than 130, the cubital tunnel pressure suddenly, I mean, when the pressure, I mean, the pressure may increase, and that will cause a compression on the ulnar nerve, and that pressure would be increasing significantly. The fourth RSI that I'll be talking is on the tennis elbow, the lateral epicondylitis. So again, the high risk patients being when the wrist extensor and the flexors while texting the I mean, especially on large screens and holding the phones by looking down in awkward positions, the patient may get a repetitive stress injury on the lateral aspect of the elbow. We could see that and document it, especially in the patients having one hand texting and trends towards a bigger touch screen, and it causes a lot of stress over the lateral aspect of the elbow. So what we should do? So if the thumb and the wrist ache after 10 to 15 minutes of usage, when you note that you should stop for 30 to 1 minute, 30 seconds to 1 minute, and take a break in between. And then you have to get the wrist to the level of your eyes, and then be using the device. For longer devices, longer messages, we should dictate or use keyboards, so that two thumb texting is avoided. And if you game scroll on bigger phones, shorten the bouts, alternate hands, and use grip and stand or a stand to reduce pinch and deviation. And if you are taking long calls, use an earphone or a speaker, and keep the elbows less than 90, and don't lean on the ulnar groove. So, in short, the take home messages are RSIs are real in smart Indian smartphone users, they being most commonly decurvance, carpal tunnel, cuboidal tunnel, and selfie elbow, that is the lateral epicondylitis, and especially it is common in younger patients. And this is one thing to keep in mind, because earlier it was found in older industrial workers, but now it is even found in younger group. These risks come from how we use the devices, as in prolonged thumb texting, bent wrists, one grip hand usage, and long calls with the elbow inflection. These are the culprits. Simple alternative preventive long-term damage by keeping the wrist in neutral, alternate hands, and using voice to text stylus usage, and taking micro breaks in every 20 minutes, and using a stand or earphones go a long way. If the mantra you want to remember, hold smart, switch often, and rest brief. In short, save your hands. Thank you.
Thank you, Karan, for your lucid talk. It was really an eye-opener. Uh, these RSIs and the smartphone usages are now here to stand with, and they are going to worsen over the period of time. So yes, it is very important to create awareness about these, and the preventive aspects that you told that were really fantastic, and to be taken points to be taken home.
Thank you, Anand.
Now I would invite our next speaker, Dr. Yash Makadia, and talking his talk is on the industrial hand injury prevention, one of the very important ones, particularly uh, apart from the medicos. This talk is going to be very important for the public at large, the population in general, because how to prevent these industrial hand injuries is important.
Good evening, all. Again, happy and Surgery Day. My name is Dr. Yash. I am from Rajkot, Gujarat. Today's my topic is all about prevention of industrial hand injuries. So, total 75% of injuries in the industries are hand injuries. So, such a large amount, over 60 million cases per year, and even India contributes most of the numbers of them. Out of these injuries, total 25% injuries result in permanent disabilities. So these injuries, most of them are preventable injuries. So again, if we divide the contribution of various injuries, 47% injuries are due to entrapment into active machines, while 25% injuries during lifting and transportation, while 20%, 12% while handling the tools. So how it happened? It is important, crucial to ask the patient which machine caused the injury, because sharp edge tools like grinder machine cause sharp lacerative injuries, whereas rotating machines like conveyor belts and oil machines cause degloving or cross avulsion type injuries. So it is important to discriminate these injuries. So these degloving or cross injuries are much more difficult to treat than sharp lacerative injuries, and even poor prognosis will be there. If there is contact of chemicals, alkali, acids, heat, cold, or electric burn, then there will be for the burn management. Obviously, it will be different protocol. So the spectrum will be mixed from minor cut to soft tissue crush to fractures to even severing of the fingers. So now preventive aspect. So what can be done from employers and even from employees? So most important is educating and sensitizing the workers to the potential hazards. That is very important. Other things are safety guards and sensor use. Installment of these devices will prevent the injuries up to many much more level. So awareness manuals, posters, all that things, and use of ergonomic tools, right, and proper size tools, that will be beneficial. Now, what can be done from a worker or laborer perspective? So first of all, stay alert and focused, adequate sleep and diet and periodical rest. So in our everyday life, probably this is also most important thing to consider. There are chances of focus lapse and then major disaster will happen. So the famous example is pilot error and aviation accidents. So we can prevent such injuries by proper alertness, focus. Then other things will be uses of proper gloves, keeping the hand free of oil and grease. So if there is any cut or any laceration, will not be contaminated. And another important thing is do not wear rings or jewelry. Some wears kada, so that will contribute to the major degloving injury or even major amputations. There should be ample space for working and obviously avoiding the drug intoxication and alcohol. So it's work smarter, not faster. Do not count on reflexes. Avoid risky behaviors. So these are some common machines which causes injury in Indian setup, like air buffers, grinders, impact wrenchers, and electric saws. Uh, there are also some high pressure gun injuries, some acid, alkali, or electric burn injuries. We that can may not look serious on first instances, but it may have a big iceberg. So somewhere in our life, we have in our practice we have faced severed or amputated fingers. So in general public, there is a myth that it should be bring to the doctor in chilled eyes. So no, it is not true. So how to transport that amputated part or any digits? So first of all, we have to wrap that part into moist gauze piece or moist towel, and then put that part into clean dry plastic bag. That plastic bag then should be placed into the 50% ice and 50% water or saline mixture. So this is the ideal method to maintain the proper cold chain. So with this method, we can reimplant the amputated part up to 24 hours, provided that the proper cold chain is maintained. Okay, thank you. Again, safe and full life. Thank you for hearing.
Thank you, Yash, for a wonderful presentation. This will go a long way in creating awareness among the industries, and few of your slides would really be very helpful for the industry people to understand the problems. Uh, we have dealt with the smartphones, we have dealt with the sports persons and the routine industries, but what we forget is the domestic injuries. And with the kids around, a lot many kids can get injuries for that. So, calling back my dear friend Dr. Harshil Parekh for his talk on pediatric and domestic hand injury prevention, a very important topic. Thank you.
Hello friends, myself Dr. Harshil Parekh working as a consultant at Restore Orthocare Hospital Rajkot. I have been allotted topic on pediatric and domestic hand injury prevention. If we know how injuries are taking place, then only we will be able to prevent it. I'll be talking on this topic with main three highlighted points. First, who is vulnerable? Second, why they are getting injury? Third, how to prevent this. Now let us start discussing various injuries one by one. I will be covering three injuries: pediatric door crush injuries, pediatric burns, and bike chain finger injuries. So let us start with the door crush injuries. This is a typical injury when fingertips are involved with unexpected closure of doors, drawers, or gates. Here mainly fingertips are involved. Severity of injury depends on at what level finger is injured and force exerted by closing object. It can give to permanent damage if not treated properly. Who is vulnerable? Anyone is vulnerable, but most commonly playful kids around 5 years of age are affected. At this age, they are fearless, excited, and curious, which is normal part of their behavior and growth. Why they are getting injury? Unknowingly, door, gate, and drawer is being closed when kids are holding it. Usual sight is a hinge part of the door. How to prevent this? We can prevent by remaining cautious when kids are around. When we are closing door, always look around and check that it is all clear for closure. And when kids are around, close everything slowly. Restless and speedy attempt to close the door is always dangerous. There are some door edge protectors, but its effectiveness is doubtful. Remember, self-awareness is always better than getting regretted for lifetime. Second is pediatric hand burns. That is again very common. As I have told earlier, kids are curious and fearless. When they are hungry or when they are following their mother, unknowingly they are getting close to cooking area near hot boiled milk. Mostly mothers are careful, but it needs only a fraction of second for an accident to take place. There are few tips to prevent the mishap. First, keep cooking stove and hot items on platform rather than keeping on floor. Second, keep knife, fork, hand bladers, other sharp object hanging on wall. Third, make sure kid is not entering in kitchen. Even if kid has entered, give all your focus and try to figure out what kid is seeking for and make sure you get him out of the kitchen. Fourth, ironing of clothes or frying of food particles need to be done when kid is sleeping or busy in playing. Third most common type of injury is bike chain finger injuries. Yes, you will be surprised to know, but bike chain entrapment can ampute finger in just a fraction of second. Who is vulnerable? Teenagers who have been gifted a new bike by parents. They love their dream bike. They are very possessive and caring regarding cleanliness of it. Why they are getting injury? An enthusiastic attempt of cleaning the bike, cleaning not only outer part but also opening and going in a internal complex corners like bike chain area. While oiling or cleaning the bike chain, it needs to move. Cleaning cloth is unknowingly trapped by chain wheel spoke. Along with cloth, the fingers are pulled inside and got crushed. How to prevent this? Do not clean inner and moving part of any machinery. Always stay away from moving articles. There are special professionals who are master in cleaning or maintaining bike up to date. They have special tools and instruments. It's their job, let them do it. Usually there are written caution on dangerous area, but we are not taking it seriously and inviting troubles. Thank you for watching this. I hope you can help us to spread this valuable information for well-being of society. After all, safe hands means full life. Thank you.
Thank you, Harshil. It was crisp and to the point, very particular points well taken from that.
Thank you so much,
And
Anand bhai.
yes, and now I would request Dr. Kushal Shah from Mumbai, to summarize the things, to summarize the proceedings, and give his concluding talks. Over to you, Kushal.
Hi. So today we have heard from my colleagues about how sports, technology, industry, and even our homes can put our hands at risk. Each talks highlighted on one truth, and the truth is our hands are central to how we live, we work, and express ourselves. The theme of this National Surgery Day today is Safe Hands and Full Life. I believe hand is more than an anatomy. As truly said, whether it is a child holding a parent's finger, or a worker earning his daily bread, or an artist painting a canvas, hand gives us independence, dignity, and joy. So today, sports and safe play are most important. Every catch, every shot, every run depends on safe hands. The amount of injury we prevent on play, it enhances our performance. So from playground to podium, protect your grip of life. Digital and rapid stress injuries awareness, where in today's world we have our thumbs, which are acting as a new pen, balance the screen time and strengthen to make sure that the time is not wasted. By balancing the time, we can make sure that technology can lead us to a great pathways by not letting us being a lazy people. Into the safety, the machines can be repaired, but hands cannot be. Yes, in India, now we have a program of hand transplants, but it comes with a cost and its consequences. A protective gear is cheaper than living or losing a livelihood. So I believe safety at work is security at home. Pediatric and domestic injuries are very common. Little hands, they have a lifelong impact on our future. A stitch in childhood can save a function in adulthood. So prevention starts at home. The common thread today is different causes. One consequences can cause us disability. A different strategy, a solution can cause prevention. Together, we can ensure safe hand and full life. What makes hand surgeons so special? An orthopedic is trained for bones and joints. A plastic is trained for skin and soft tissues. Hand surgeons. Basically, we are an orchestra conductors. We deal with bone, tendon, nerve, vessel, and skin together. We just don't fix any part, we restore function. As a hand surgeon, we stand a crossroad with plastics, orthopedics, and microsurgeries. We are uniquely equipped with to preserve function, prevent disability, and restore hope. So today's promise as a hand surgeon is we bring form, function, and feeling back from injury to artistry, from trauma to triumph. Unique is because we heal not just structure, we strength, we make sure that he builds strength, skill, and soul to his hand. On this National Surgery Day, let us carry the message beyond the hall to the school, industries, workplace, and homes. Prevention is the best protection. And when injury does occur, let society know the expert hands are here to help. So now I end by the closures of safe hand and full life. Let this not be just today's theme, but our lifelong mission. Because when we protect the hand, we preserve human spirit. I welcome the audience for question answers. Thank you.
Any questions there? Oh, Karan, that the questions that you have posted are yours or they are from the audiences?
No, actually, I had a few questions, as in these are the practical scenarios that we face in practice. So if there are many people from the general audience also attending the CME, so if there is any in specific message that needs to be told to them, it could be directly addressed at this platform itself for the benefit of audience.
Yeah, so I think the talks were very lucid and fantastic to the point, very crisp, bringing home the perfect points altogether. And once we see these talks, a lot of strategies and understanding mechanisms start revolving in our head. how to protect ourselves, and how to keep us as well as others safe. I think yes, the talks were very good on that aspect. Any specific question or any questions there on the host platform?
I have written my question. Could I ask them directly or?
Yeah, you can address to the concerned speaker.
Okay, I'll ask the question. Anand bhai, whoever you feel could answer this question. So there are certain patients of ours who would be suffering from hand injuries. They would just say that, oh, I just need to lift that object from the machine, or just take the cloth out, and it will just take 1 second, and they would not wear the gear, or take the precautions. So if would you want to address the situation, in the light of people who are working on machines?
Yes, I think you should be the correct person to answer that.
Yes, sir. Uh, Actually, the workers working on these machines are actually that's it. Its work is routine work. So if there is lapse or focus, if there is by chance there is entrapment, we as there is injury, it will be actually it will be very bad. Uh, Even workers are human beings. The employees also human beings. So at the there is it will take only single moment to happen this disaster. So it it really it should be, I think it really it should be prevented, because these are highly preventable injuries, and we face this significant amount of this kind of patients into our OPD or emergencies.
So like
Yes,
we
as is said, nazar hati durghatna ghati.
Hmm.
Yes,
So it takes just a split second for a disaster to happen. So as
yes,
was rightly pointed out by Yash in his talk also, you have to be continuously awake and alert when at workplace.
yes,
So like we put in warning signs in front of cigarette packets that can cause cancer. So similarly, we should be posting photographs of different cut injuries that happen, because as soon as what happens that whenever the patient sustains a cut injury or a crush injury, he's been sent to his village, and he's not been seen also. They will be offering like a surgery for the patient, and as in ke jo karna hai, just ek surgery mein kar do. So I don't think that people are highlighting enough the injuries that may be happening. So we could put in a statutory warning on behalf of the Gujarat Hand Surgeon team only, that or the Indian Hand Society. It should be issued in all industries that the consequences can be quite severe and lifelong. So what is your take? What is the panel's take on the situation at the current moment?
I believe most of the norms for industries have been regulated by government now. Many industries do follow norms properly in a proper way. When you look at the construction site people, or when you look at the industries, except the local industries wherein they still don't follow the regular regulatories affairs regarding how we can salvage by preventing. More and more awareness by going to those industries by hand surgeons, or giving them a talk, or making sure that these people who are at risk, the workers, they should be educated that work is just a part of your life. You have to live life. You are working because you want to live a livelihood. But in case if you don't wear a protective gear, you will lose a livelihood by not earning for a family. So when something sensitive has been talked to them, they will really understand the crucialness about the injury, and they themselves fight prefer wearing a protective gears.
As is said, there are no shortcuts in life.
Awareness is the
Uh,
key. Like
Yes,
we can
correct.
prevent awareness by industrial hand injury prevention programs. That is the thing. I think in this whole talk, we have not talked about two things. That is wrist arthroscopy or arthroscopy in hand surgery. And the other thing is hand transplant. I think Dr. Kushal can share some facts about hand transplant and like uh, audience will be happy to know that India is like first and please, Dr. Kushal.
So yes, definitely hand transplant is a good program we have in India now. Many centers in India has this program which has built up, and India is among the first country to already surpass more than 73 hands as a hand transplant. Definitely, bilateral hand, when someone is an amputee with a bilateral hand, is a absolute indication for going for a hand transplant to restore the hand and function, so that he can be independent for his all activities, and also he can live his livelihood by making use of his hands. Still, there are questions, or still there are relative indications on a unilateral hand and a congenital hand. Yes, we have performed on these scenarios also, but the humans or the person who undergoes a hand transplant, they have to be very sure about, it's not just that one limb is transplanted and you'll be able to do everything. They should be aware about, they have to take regular medications, they have to follow strict guidelines. There are many ways where they can get infected, so they have to always cover their mouth with a mask. They cannot go to a public place just randomly. They cannot eat any raw food. Say for example, if they're traveling and if they really want to enjoy eating corn from outside or a bale, they cannot have it. Every food should be boiled. So after taking proper counseling, by telling patient when they come for a hand transplant that no, yes, we can do for you, but these are the pros and these are the cons of hand transplants. If and by chance when he comes again and again repeatedly that no, I have an urge and yes, I want to go ahead with a hand transplant, that is the time we try to register that patient, and then we wait for someone who can help us donate. The donations, yet it is a myth in India. Most of the Hindu mythologies, when they say that when we give some organ, in the next birth, those organs won't be there. So that myth has to be tackled care well. Rather, we can see hand transplant as a donation, as a legacy. When a family donates, they should be given utmost amount of respect. Rather, the zonal transplant coordinator and the national transplant NTCC can help them giving some stance and values to that family for donating, so that many people can be aware about how important a transplant can be. And with one single human, when they transplant everything, they can actually save almost 20 humans after donating, say from skin to bone to eye to liver to multiple solid organs. So a human death can serve 20 live humans. If this quote goes well and the awareness is more, like in Surat, I think Surat will surpass as not just a diamond industry, but a donation city for India too, because they're the maximum in donations when it comes to any hand. So yes, awareness should be uh, the key, so that more and more donors are coming to us and more and hands can be transplanted, and maybe in a future there will be very less hands who will be waiting for hand transplants. Thank you.
So like uh, in prevention aspect, we have mentioned two, three topics, but there are many other topics as well. Like our housewives, where we see, like we have that grinder blade cut injuries, housewife mixer grinder cut injuries, washing machine crush injuries, and Also, regularly she has this tennis elbow problems. So that also need to be mentioned or can be prevented by taking regular breaks in their work. Just sticking to preventive aspect of hand surgery.
True.
True, points well taken. I think now we can call it a day. It was a very energetic program, and we all loved all the points. And this will go a long way in bringing more and more awareness, particularly about the preventive aspects of the hand surgery. And as everybody was pointing out correctly, disability prevented is much more important than treating a injury. I think we can call it a day now. Thank you.
Thank you.
Thank
Thank you.
you.
Thank
Thank
you.
you, everyone.
Thank you, everyone.
Thank you.